So went to go see the doctor yesterday, had some blood work done, and saw that my liver function numbers had deteriorated slightly. Now, this isn't necessarily a bad thing, because we already ruled out ascites, which is fluid buildup in the abdomen, as well as vascular issues within the liver, causing any type of blockage or inefficiency in blood moving in and out of the liver. So I think I was thinking that it could be potentially a good thing where the PRRT or targeted therapy treatment is actually killing the cancer cells and potentially causing the liver to have to remap the blood flow, meaning that the liver compensates when there is some slight blockage due to the scarred tissue when the cancer cells are killed. And that can take some time to kind of rewire the liver so that blood can flow efficiently. So that seems like a plausible explanation at this point, now that we've ruled out some of the more negative things. So could be a good thing. Now, when speaking to the doctor said that my numbers are stable enough and good enough to potentially try a more localized treatment, which is called proton therapy. So proton therapy is special in that it can target cancer cells without hurting any surrounding tissue, which means that it can be used more frequently and over time. Because previously we couldn't do anything like this because, you don't want the liver to be under too much stress, because if the liver goes, yeah, I can go. But with now that the progression is somewhat controlled with the targeted therapy, it opens up new avenues, which could potentially open up a curative path. Now, I don't want to get ahead of myself in thinking that, everything's going to be fine. I'm going to talk to the doctor and see if I'm eligible for this treatment. I'd be one of the earlier patients to receive this type of therapy because it was just cleared in Thailand. So, new hope. But yeah, just, taking it one day at a time and fighting as hard as I can. So, still fighting hard every day. Thank you very much for all the comments and words of encouragement. We'll talk to you later. Bye.